I'll take that as good. Everybody have a nice weekend.
Pretty busy.
I worked all weekend with
We have an
Florida's.
exam. We have an exam tomorrow, and we have a big paper that's due next week. So it's been busy.
In what class?
Leadership is the paper, and an exam on mental health tomorrow.
Okay.
Yeah, I'm taking that exam too. I feel it.
Yeah.
Well, I'm still up here in really cold northern Wisconsin, northwest Wisconsin. I go back to Denver on Saturday. It's pretty darn cold up here.
It's like 76 right now here. It's pretty warm.
Where are you, Michael?
Florida, Port St. Lucie.
Oy,
And it's a cold front.
oy. I think I might get to go down towards Jupiter maybe in March. Um, my parents they usually go to Florida for the winter. My dad's having some health issues. He was just diagnosed with prostate cancer. So he's having a PET scan tomorrow, and they're not sure when they're going to start treatment. So if they wait for a couple of months to start treatment, I don't know what the oncologist is going to do. They'll be down in Florida for March and April. So I might scoot down there for a little bit.
Jupiter's absolutely beautiful. It's only like 30 minutes away from us.
You really,
It's
yeah,
nice, yeah.
yeah, yeah. So hoping to scoot down there a little bit. Thank goodness I have a son. One of my four kids, Connor, is a commercial pilot for Southwest. So I get to,
I ain't got nothing special to say about my corner of Florida. I'm in Jacksonville.
Jacksonville.
Oh boy.
Is that is that is Jacksonville the Seminoles?
No, that's we Jaguars.
Jacksonville Jaguars. Oh
Yeah,
no, I'm
the
thinking
Seminoles is,
Tallahassee.
yeah, it's
I'm think
Tallahassee. Yeah.
yeah, I'm
Hello,
thinking Tallahassee. Your quarterback.
Yeah,
Is that my friend Trevor?
yeah, Trevor Lawrence. Yeah, that's
Yeah,
our guy.
I like him. I like
He's
him. I grew up in a football family. My dad was a college football coach for 40 years. So I love football, love college football. But yeah, I kind of grew on that Trevor Lawrence kid. He was pretty,
oh hell yes, hurt them in the long run. You better believe it.
he what? He's got to be a pretty popular dude down there.
Yeah, he's got a good personality, I think. So,
He's so
that's
young and
important.
he's so new. I was impressed. Anyway, how's everybody doing for a Monday? When you have a minute, if you could put your name and your campus in the chat. I was just looking at two deers running across the lake. Three now. Ugh,
Well,
I'm out in the middle of nowhere up here. Nowhere. It's us and the
sometimes
wildlife.
sometimes being in the middle of nowhere is nice.
Yeah. Yeah. No, yeah, there's something to be said for being in the middle of nowhere. Lots of wildlife around, lots of deers running around the house. The lake's completely frozen over, completely. So it's
Well,
pretty. It's
sometimes I
pretty.
go stay with my grandma because she's kind of in a part of Florida that's very like just, a lot of just
Hmm.
land.
Yeah,
It's nice. I go there when I want people to leave me alone.
exactly. Yeah, yeah. Well, I'll have been up here a couple of weeks. Come Saturday, I'm ready to go back to Denver. I've got some stuff to take care of in Denver. I had some back surgery right before the week before Christmas. I had a spinal fusion. And so I need to head back for my continued post-op appointments and get some PT going, whatever. Has anybody ever had a spinal fusion? It's
Doesn't sound
rough.
fun.
It's rough. It's been a rough 6 weeks. But anyway, it needed to happen. So yeah, anyway, that's what's going on. Okay, let's get going. How is everybody? Make sure you put your name and your campus in the chat. I need everybody, when they get situated, to turn their cameras on. I need to be able to see faces and not walls and ceiling fans and lights and things I'm looking at now. So we are recording. So we're going to cover last week and this week. We're going to cover weeks 4 and weeks 5 this week, so you don't miss out on any content. You were sent all of week 4 reading information. Last week I know was an exam week, and then we'll cover week 5. I'm not going to pull up all the readings. You guys are expected to do that, but we'll review all the different concepts that are being covered. With regards to the exam, congratulations to everybody who scored above the 78. And then I sent out an email over the weekend that asks you to sign up for some times to review the exam with me. And that's for anybody. I really encourage the people that scored less than a 78 to schedule a time with me. And a lot of people have already. Have a lot of reviews coming up this week. I've already done several today. So if you haven't signed up, pardon me, for a time this week, please reach out. I sent the available times. I'm down to Thursday and Friday. All of today's slots have been filled, and all 7 slots for tomorrow are full. So, and Wednesday's just too busy of a day for me. I teach 2 classes. It's just too busy. So Thursday and Friday. So please schedule a time. And then the other thing to remember that I have to do weekly at-risk reports for each of your campuses that go to your deans. They're not due till Mondays. I try and do them over the weekend. And so I've already heard from some students today. If you're hearing from your dean about, setting up, let me back up. I do at-risk reports for students that are below a 78, students that are having attendance issues, and students that are having homework issues. Okay, so I send those reports to your deans, and so your deans will typically reach out to you with issues. So don't be surprised and don't be thinking, oh gosh, how'd they find out? I'm required, all of us, all the faculty is required to do these risk reports. Okay, so I did send out several over the weekend. So if you fall into those categories, homework issues, attendance issues, grades below a 78, or other concerns, expect that your dean got an at-risk report for you. Okay. Any questions about that? Okay. Michael, You had a question about the group project. Go.
Yes, do you want us to submit the paper in like sections
Mm-mm.
or just as one?
I want the whole project completed together, and all 4 or 5 of you need to submit the final project. So I realize I'm going to have 5 of the same and 5 of the same and 5 of the
Okay,
same. I
okay.
get all that. But the reason why everybody has to submit it is because it populates into the grade book.
Right, that was my question, because in the Canvas, I know last semester I did it and everybody else, I guess, she just had a manual put it because only I submitted it.
Yeah, everybody has to submit a copy. And
Okay.
I greatly acknowledge that I'll be reading several of the same copies. I know that, but that's why everybody has to submit it. So it populates your name into the grade book that you submitted something.
I also have a question because like I am the only one from my campus in my group, so I don't know.
Well,
Can they share their information or something?
think about it. This is an online class. Okay, I purposely mix up campuses so that number one, you get to meet new people.
Well,
And that
that is what I am asking, if
oh,
they could share the information. So
if what?
if they could share their information, because I don't know not any of the people in the group.
Okay, do you guys should have your email, the email addresses of your teammates in your student section, right? In your Canvas, right? Yes or no?
Send a message on Canvas. Make like a group chat on Canvas.
Yeah.
Like when you send a message to your professor.
Mhm. Yep. Yep. So that's exactly what you need to do is somebody has to take the lead and send out a group message. Hi, we're the Bravo group, Tyann, and how would you guys like to proceed with this project? I've heard from, I think, only 3 groups, and I think I have 6. I've only heard from 3 groups of what project or what infectious. Wait, did I already assign you guys an infectious disease?
You assigned it, yeah.
Okay, I've assigned it. Okay, so yeah, you got to reach out to your group, tie-in. If you guys haven't started working on that, probably sometime this week, I would. You know who your group is, so pull up their names on Canvas and send them a group email. So I mean, these are online hybrid classes, so the work is done online. You guys can set up a group Zoom meeting or a group, whatever, FaceTime meeting to come up with a plan for how you're going to do it. It's up to you. Does that answer your question, Tyann?
Yeah.
Okay. Anybody else have any questions on the group project? Okay. Cameras. I need everybody's cameras on, please.
No, you're gonna say turn on your camera.
Hey, do you guys have any questions from the exam? I'm hoping it'll be either tonight or tomorrow. I need to adjust it a little bit. I'm working on the study guide for exam 2. Okay, so I'm hoping to have that to you guys tonight or no later than tomorrow. I need to add some stuff and take some stuff out. Okay. What else? Everybody working on their HESI prep assignments? Nobody's is blank, right? Cover several things today. So from last week, Special vulnerable populations we talked about, or you read about, you should have prepared for. We'll do quiz 3 at the end of this content. Pregnant adolescents, LGBTQ, mental illness, those readings. Where did you guys find those readings?
In the Canvas.
Everybody know that? Those readings were in the Canvas module. Okay, they weren't in the books. And then the other concept that was covered last week was alcohol, tobacco, and other drug problems. Okay, and that was a chapter in the book. That was chapter 48 in your med-surg book. Okay. And then this week, hospitive and palliative care, along with death and dying, faith and spirituality, and ethics. Okay, in your hospice and palliative care, death and dying information, what the reading was found in your Canvas. Okay, and your faith and spirituality was in chapter 14 of your fundamentals book. Actually 14 and 15. Okay. And then your ethics information was found in chapter 3. So I don't know what you guys have reviewed, but let's, I'm assuming that you reviewed. So first of all, let's go through some information. What do you guys know about the American Nurses Association? What do you think the American Nurses Association does?
They dictate what we can do and what we can as nurses, like the scope of practice and that kind of stuff.
Mm-hmm. They define our standards of care for our professional practice. Okay, everybody falls under American Nurses Association. Okay, they try and do general standards and guidelines for nursing practice. Okay, so I want you to remember that. Okay. Pregnant adolescents. What did you learn about pregnant adolescents in your preparation? What are some of the characteristics of pregnant adolescents? How did we get here? What are some challenges? What kinds of care do we provide them? I don't know who has the TV on in the background, but if you could mute yourself, that would be great. Okay. So tell me about pregnant adolescents.
They're a vulnerable population nowadays, and it's getting more common for younger adults, adolescents to get pregnant. Me personally, I think that it's like a lot of people are doing it and they want to be part of the group rather than like responsibilities and that kind of stuff.
Okay, thank you. Does anybody work with the teen pregnant population or have worked? What else do we know about the teen population? What kinds of challenges?
Definitely mental health.
Okay, for what reason?
That's a major impact on that person and perhaps their plans for their life, even body image, of course. And then, just in general, figuring that out, especially if they don't have a very good family support system. They're kind of like, okay, well, what do I do with this thing when I have it? How am I going to get this together and this and that and the other thing? And it all kind of piles up and kind of makes for a stressful situation for that person.
Well, that's right. Thanks, Trent. We also know that there's a lot of self-worth issues, right? Low self-esteem, low self-confidence, fears of inadequacy. right? Maybe teen pregnant moms are trying to escape from abusive or dysfunctional families or relationships. What do you think about that?
Nutritional and prenatal care.
Yep. Yep. When you're communicating with teen pregnant clients, what do you think the best approach is? This is all from your readings. So I'm just trying to review what you went through in your readings. What's the best? How do we use therapeutic communication? First of all, what is therapeutic communication?
Therapeutic communication tends to be non-judgmental, mostly. I mean, with that, you mainly want to, one, provide comfort, and two, gather information. So
Okay.
more, ask questions, but don't ask too much. And try to,
Ask open-ended questions.
there you go.
Mhm.
And being like non-judgmental, do not judge them and tell them what they need to do.
You know, how are things going? How's your pregnancy going? Open-ended questions. Have you started prenatal care? Right? Teen pregnant, what are some other health issues that go along with teen pregnancy? What might be some comorbidities?
Like they're not fully developed and they're going to quit school,
Mhm.
urge them to go or continue on.
What about sexually transmitted
STDs.
diseases?
Mhm.
Yeah, who just said that?
I did.
Yep. High incidence of STDs. Absolutely.
High risk for preeclampsia, low birth
Preeclampsia,
weight.
preterm births, low birth weight babies.
I think risky behavior as well because they're still teenagers.
Yep. Teenage pregnancy, when we talk about a pregnant mom, that's not necessarily a vulnerable population. But as we've talked, teen pregnancy is considered a vulnerable population. There's so many factors that go into it, and there's so many barriers already against this population. What do you do for a new mom, a new teenage mom in the postpartum world? What do you think's going on?
They're
Well, I
all
mean,
prone for postpartum depression
Mhm.
because they don't realize what's going on until they actually push the baby out and they're like, oh my God, what did I do?
Right.
it's also kind of important to make sure they know they know what to do, because I mean, sure, most, an adult might take the initiative to go and research what they need to do and this and that, but one, if it's unexpected, and two,
Mhm.
if this person's a teenager and not quite adjusted to life as an adult yet, they're not going to be able to really figure out the right steps to taking care of that child.
Mhm. So if you're the nurse going in to do that first visit, how are you going to assess how things are going? And what are you going to look for? Are you going to look for cues that maybe that they are bonding or not bonding?
Mhm.
Okay. Do they know how to act on the cues of the baby? Why is the baby crying? What about the relationship if there's other people there, whether it's the father of the baby, the spouse, the family? Is that an opportunity to assess the functionality of how things are going? It's a big risk. And if you're working with teen new moms, it's a big challenge. There's a lot going on. And you have to be able to do your, do your ad pie. It's one thing to have them deliver in the hospital and then they're home the next day. You now are the community nurse that's doing a visit to these new moms? What's important? Does she know how to feed the baby? Does she know how to burp the baby? Does she know how to respond to its needs? Does she change the diaper? Are they bonding? Is there eye contact? These are all things that are important to be able to assess with that teen pregnant mom. Okay. Mental illness, anxiety, mood, and eating disorders. Okay. Who are some vulnerable populations that are high, very, very high risk for these issues?
Caregivers.
Caregivers. Mm-hmm.
Elderly.
Pardon me?
The elderly.
Say that one more time.
Homeless.
Homeless. Homeless population. High risk for mental illness, anxiety, and mood disorders, and eating disorders. There's a couple of different mental illnesses that I want you to be aware of, and this is in your reading. Okay, the first is general anxiety disorder. This is in your reading. Can somebody tell me what general anxiety disorder is?
Constant, persistent anxiety that often impedes social functioning.
Mm-hmm. Yeah. And typically lasts longer than 6 months.
Yeah.
What about a phobia? What's a phobia?
Consistent, persistent, irrational fear of something, whether
Mhm.
it be a person,
Mhm.
a situation, an object, or spiders like me. I
Mhm.
don't do no spiders. No, thank you.
That's like me with snakes.
Nope.
Mhm. Again, this is all from your readings. Okay. What about OCD? What's OCD?
Disorder.
Anybody?
OCD is obsessive compulsive disorder, often has particularly repetitive behaviors
Mhm.
that a patient often can't really control and can sometimes get in the way of how they operate in life because they have to do things a specific way, and it can often be difficult for them to break out of that because they require the repetitive behaviors.
Mhm. Anybody have anything to add to that? These are mental health conditions that you're going to be tested on your next exam. So we need to know these. Okay. What about bipolar? What's bipolar?
Bipolar is often I'm sorry, I'm talking so much. I just
No,
love mental health.
anybody
It's my
jump
favorite
in. No,
subject.
that's fine. Jump in. I'd like to
But
hear from everybody. This is interactive.
It's like the mood swings.
Say that again.
Like someone with mood swings.
Okay. Mm-hmm. So maybe extreme sadness, extreme hopelessness, helplessness.
So the way I remember bipolar disorder is I think of how I feel emotions, and then I kind of step back and go, okay, well, what if it was turned up to 11 every time I feel these emotions? It's constant up and down with those patients.
What is one of the most common drugs to treat bipolar? What is that?
Lithium.
Lithium. Tell me about lithium. If we have a patient who's taking lithium for a bipolar disorder, what do we want to tell the patient? We're the doing the discharge teaching.
You have to be careful with
levels
salt.
monitored.
Go ahead, say that again.
That they need to get their levels monitored with the lithium.
You have to be careful with salt.
Exactly. That's one key factor. Be careful with salt.
Increase fluid intake.
Increase fluid intake. Okay. So lithium. Be familiar with lithium as it treats bipolar. Let's talk about primary, secondary, and tertiary prevention levels with mental health disorders, anxiety disorders. Well, actually, let's talk about primary, secondary, and tertiary with mental health in general. What would be some primary preventions?
Maybe reduction of factors that could cause stress, because I mean, we're in primary, so we're trying to stop these things from developing and getting that snowball rolling.
Yep.
So maybe teaching stress reduction techniques, or
Perfect.
possibly assessing environments to figure out
Yep.
what would be best for that person.
That's exactly right. It's trying to prevent something before it ever occurs. Just think of primary intervention. So for example, in my school nurse job, I did lots of education with middle school and high school students. Suicide prevention, coping strategies, risks of drug abuse, risks of unsafe sex, risks of obesity. Okay, there's plenty of prevention tactics that you can use to help students, people with kind of prevention strategies for mental illness, anxiety disorders. What's a secondary? What are some secondary interventions?
Using the pH.
Oh,
Go ahead, Emily.
Sorry.
Go ahead.
Using the PHQ-9. The
To do
assessment,
what?
to screen for depression.
Screen. That's what secondary is all about. How do you screen your high-risk population? Okay, how do you screen? How do you screen for family histories of depression, anxiety disorders, mood disorders? How do you, that's what secondary is all about, screening to identify your high-risk populations so you can intervene quickly before it develops into a diagnosis, a condition, right? So what about tertiary? What happens? What has to happen for you to be working in the tertiary level of interventions?
Well, they got to have something.
Okay.
And it's more than likely that you're going to be dealing with actual strategies for, well, I don't want to say coping strategies because you could teach those before they have some, but actual methods for correcting certain well, I was say even correcting, coping with
Managing,
behavior.
coping. Yes. So that's what tertiary is about. If they have been diagnosed with a mental health disorder, anxiety, mood disorder, substance abuse, they already have the condition, the disease. We're trying to help them manage it. We're trying to help minimize the side effects. We're trying to help reduce the adverse outcomes.
Like with me, for example, a tertiary intervention that I often have to use because I have anxiety, panic attacks, is grounding. The therapeutic technique of just naming objects around the room to pull yourself out of what's in your head and focus on what's really in front of you.
Okay. Okay. Questions about primary, secondary, and tertiary. Would you recognize one of those interventions on an exam question? You need to be able to, okay? We need to have a good understanding of primary, secondary, and tertiary. Okay, another tertiary would be counseling, right? Group therapy, counseling.
Would like medication also be?
Medication, maybe a rehab facility for substance abuse, right? Detox for substance abuse. Those are all treatments for, or tertiary treatments. Okay, tell me about alcoholism. For substance abuse, we're going to talk about alcoholism, energy drinks, tobacco, e-cigarettes, and amphetamines. So what are our concerns about alcoholism? What physical concerns do we have as we're doing our assessment?
Instantaneously jumps to my mind is liver problems.
Liver problems. What about vitamin B deficiencies? Yes. low magnesium, low potassium, iron deficiency, anemia. Those are all associated with alcoholism. Probably a poor diet, right? Maybe prone to malnutrition, right? Alcohol absorbs, we know, better on an empty stomach. What kind of drug is alcohol? Is it a depressant?
Yes.
Okay, so what might you experience with that?
Well, you're going to be pretty sluggish,
Mm-hmm.
depending on how much you drink, that is.
Mm-hmm.
I
So
clearly think
What about respiratory depression? Lethargy, confusion. These are all physical signs of alcoholism. What about your blood? Tell me about, what do you know about your blood concentration level? What affects your blood? What affects your BAC? Blood alcohol concentration. Somebody
How
talk us
fast
through
you
that.
drink?
Pardon me?
Maybe how fast you drink and how long you wait in between.
What about the concentration of the alcohol?
What you drink.
Yeah. Rate of drinking, rate of absorption. Right? We know that alcohol absorbs slower when you have food in your system. And what about the rate of metabolism? Does that play a factor?
how about weight, like the weight of a person?
The amount, listen to this, the amount of alcohol the liver can metabolize per hour, I want you to write this down, per hour is equal to three things: 0.25 ounces of whiskey, 4 ounces of wine, and 12 ounces of beer. Okay, so that's just an example of the liver metabolizing certain amounts. What are our concerns with energy drinks?
Can you repeat that again about the?
Oh, sure. 0.25 of whiskey, 4 ounces of wine, and 12 ounces of beer. Those are just some examples of the liver metabolizing different types of alcohol. Let's say you have somebody that comes to your clinic that thinks they might have drank too many energy drinks over the day. What might they be presenting to you with? Let's talk about physical symptoms first. What are we thinking?
Agitation,
Very
heart,
jittery.
fast heart rate.
Yep, I heard tachycardia.
Possibly SV,
Pardon me?
SVT.
Vasoconstriction, arrhythmias,
Dehydration.
heart attacks, potentially strokes, right? What are the concerns about tobacco? What is tobacco associated with?
Cancer, lung cancer.
COPD.
Cancer, lung disease, heart disease. What are the effects of secondhand smoke?
Asthma.
Okay. Not just asthma, kids are much more susceptible to being ill, ear infections,
Poisoning.
poisoning. Okay, that was my next question. Let's say you go and you're working with a family on smoking. It's a smoking house and they have kids with asthma. What kinds of things would you teach? Your goal is to be a smoke-free house. How do you get there? With your teaching and education with the family, how do you get there?
You can start
by
telling them to
smoking out of
smoke
the house.
outside.
Mm-hmm.
Provide humidifiers in the house. Getting like the little smoking patches sensations to try to help them quit smoking.
Yep.
Change
Excellent.
clothes before you come back in.
Yep,
Or as you
excellent. Excellent.
More than
And
likely. Oh, go ahead.
go ahead. No, go ahead.
I was gonna say more than likely also if if we're thinking first thing is if they have to smoke at the start, limiting the amount of cigarettes that are smoked in the day.
Mhm. What about moms who are pregnant that smoke? What are the risks to the baby?
Low birth weight.
Okay.
Lung damage.
What about the higher risk for SIDS?
Yeah.
Right?
Mhm.
lower oxygenation, right?
Prematurity, premature births,
Low birth
Right.
weight.
low birth weight. What do we know about e-cigarettes? What is the most dangerous part of the e-cigarette for kids?
The vapors that comes out.
Okay. What about the oil?
It's poisoning for the
Okay, you need to
babies.
remember that. If you get asked about e-cigarettes in children, what is the most dangerous part of e-cigarettes with children? It is the oil that is poisonous. Whoever said that, great job. Okay, and somebody mentioned the vapor causes lung damage in kids. Okay. So what if you're doing the teaching with the mother and she says to you, "Oh, I've been smoking outside." Okay, that's okay. I don't smoke in the car anymore with the kids. Okay, that's good. What if she says, "Don't worry, I've switched to vaping. Everything's good." Is that good?
No.
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 What are you gonna tell her?
That she still need to try to keep the same implements as if she was smoking a cigarette.
It's
the
still no
e-cigs.
good for the baby.
Yep. Okay. What do we know about cocaine, amphetamines, methamphetamines? What kind of drug are they? Are they depressants? Are they stimulants? What are they?
Stimulants.
Okay. Okay. So let's say somebody who is suspected of overdosing cocaine, methamphetamines. What are they going to present to you with?
Increased heart rate, constricted pupils, jittery attitude.
Temperature, high blood pressure,
High temperature, high heart
high blood
rate.
pressure.
Restlessness.
Mhm.
You know
It's
what?
a-
Same symptoms as your energy drink guy when you think about it.
Yep. Yep. Yep.
It's
High
all
blood pressure. All your
cardiovascular.
vitals are going to be increased, right? Heart rate, blood pressure. And this kind of situation requires emergency treatment. Right? So again, let's think of these clients presenting to you at your clinic or your emergency room or even in the community. They're presenting at urgent care, the emergency room, what if it's a home visit? And that's what you're presented with. Okay, these issues are very prevalent in the community. All right. And if you're working in community nursing, you're going to be dealing with these. Any questions about the special vulnerable populations? That would cover week 4. Okay, let's move into this week, which is hospice and palliative care, death and dying, faith and spirituality, and ethics. Okay. If you're working with a client that is dying, you're a hospice nurse working with death and dying, what kinds of things, what kinds of roles might you play with the family? What's most important? What's most important for the death and dying patient?
Be comfortable.
And how are they comfortable?
It could be just as like just giving them a bath, maybe brushing their hair,
Mhm.
and being supportive of the family, just being there.
Okay.
Even spiritual, just bringing people from the spiritual.
What about pain control?
Yes.
Pain control is really the most important task we have as a hospital. I mean, obviously everything Michael said is true, but in the big scheme of things, we want them to be comfortable. Okay. Providing comfort, maintaining the client's dignity and self-esteem. Okay. Therapeutic communication is really important with the death and dying family, patient and their family. What would be some examples of therapeutic communication with regards to the family or the patient?
Like if they have like a wish, like certain courses, like they want the doors to be or the windows to be let open when the patient dies so the spirit can go out. Just asking them like what they prefer when they die or coming up to when they die.
Okay.
Adhering to culture.
Culture, really, really important. What if the client says to you, why is God doing this to me? Why am I, what did I do wrong? How can you counter something like that with?
So you think God is punishing you?
Asking them open-ended questions by.
Right. One of the things that I think about is, do you have somebody you can speak with? Do you have a pastor you can speak with? Do you have, somebody in your congregation, if you belong to a congregation?
If the hospital in particular has a chaplain,
Yep.
that might be good to call him or
What do
her.
you do? What do you do with family members? Let's say you have family members that really aren't in sync with what's going on. They don't believe in pain medication. They don't believe whatever. They don't believe in part of the plan of care that's going on. What is a hospice nurse to do? Or one of the responsibilities of a hospice nurse is to try and care for the whole family, right? So what would you do as a hospice nurse to try and bring everybody together?
Try to involve them in the care.
Okay. Go ahead, Marina.
You can educate them on about the different pain medicine and what they're for and what they're used for, and also let them know like certain wishes of the patient, that this is their wish that they choose to have done, or this is the process that they would like to go through, and just trying to keep them informed about it.
Yeah, that's excellent. Anybody else? End of life care for a hospice nurse is really difficult. If everybody's not on board with the plan, they really need to try and pull everybody together. Maybe that family member who's not participating has had a recent trauma in their life, or a recent death in their life that's affecting their ability to participate in this current family member's end of life decisions. Does that make sense? Open-ended questions. Can you share your concerns? Can we talk about this? Right? Okay, faith community nurse. What's it? Anybody ever heard of a faith community nurse? A lot of people haven't. I'm surprised. What's a faith community nurse?
Is that where they go to like parishes and stuff?
Or they're part of the parish.
Part of
Excuse
the
me one
parish.
second, Michael. I need some people to turn their cameras on. Stephanie, Yashika, I can't see you. I'm looking at your ceiling. Stephanie, I don't know where you are. Samantha, you've had a green screen, right? Are you having connection issues?
I must. I'm sorry. I don't know. I can try to log back or log out and log back in.
Yeah, try that.
Okay.
Is that all I see is a green screen? Okay. All right, so let's talk about a faith community nurse. Does anybody know a faith community nurse? I have two girlfriends who are faith community nurses back home in Denver. Okay, faith community nurses can be whatever religion you practice. They can be in a church, they can be in a mosque, they can be in a temple, it can be whatever religion you are. It's not confined to one religion. And typically a faith community nurse works within the congregation. Right? They work within the congregation to do whatever the governing board or governing group of the congregation decide they want the faith nurse to do. Faith nurse does a lot of primary prevention activities, primary intervention activities, secondary. They're usually trying to be proactive. Okay, they may do health fairs. They may, in your book, it has a nice, or excuse me, in your reading, I believe, no, it is in your book. It has a box of what are some of has a box of what some of the roles of faith community nurses are. Okay. Typically, there's two kinds of faith community nurse models, and we need to know this. Does anybody know what they are from their reading? What are the two models of faith community nursing? Okay, the two models are spirituality and religiosity. Okay. So in a spiritual model, or think about it, your religion takes into account your beliefs into your nursing practice. Okay, so it's your religious traditions. Okay, so it's, let's say our whole group was the same religion in the same congregation. Okay, that's religiosity. We're dealing with one religion. Where spirituality is what each and every one of us have our own belief of what the higher power is, however that looks. Okay, so religiosity, we're focused on a specific religion. The concept of spirituality is, how do we feel about, what's our concept of spirituality? Does that make sense? The other two things that you need to know, the other thing you need to know about, there's two models of faith nursing. One is congregational and one is institutional. This is in your readings as well. And you got to know this. Okay. If the faith community nurse is working within a congregational model, that means she's working within her congregation. He or she working within their congregation. They're seeing whatever families, new parents. They are doing, they're doing grief support groups for grief counseling for a recently passed away family member. They're working only within their community, faith community. So that is the congregational model. They're working in the congregation. Where the institutional model is that they branch out. They reach out and coordinate, participate, partner up with services in the community. Maybe transportation to doctor's appointments. They partner up with a transportation company, long-term care facilities that they admit patients there, urgent cares that they use. All right, so it's a partnership with different resources in the community. That's what institutional faith-based nursing is. Okay, does that make sense? Let's think of what would be some primary interventions of a faith community nurse?
Maybe Well, I shouldn't say mental health counseling, but perhaps offering advice about certain conditions that somebody might have and interventions that they could do, or, if it's tied in with the faith, perhaps, utilizing that in conjunction with, mental health care, to kind of have both of them work off of each other.
Okay, great. And remember, the faith-based nursing, it brings in all of our, he or she is using our nursing process, no question. But what we're adding is the spiritual aspect. That's what faith-based nursing is adding the spiritual aspect into the care, the holistic care. So maybe they're doing groups, they're doing support groups on healthy diet, healthy exercise, new parenting skills. Right? Wouldn't those be some primaries? What would be some secondary interventions for this group?
For
What about
signs
blood pressure screening. Sorry.
Screening? What about doing a health fair? Screening for blood pressure, screening for blood glucose, being able to provide immunizations. Actually, that's primary. But immunization information would be a primary intervention, but secondary, screening for mammography screening.
Discuss screening, like screening tools visit when you go over there.
Yep. And what about some tertiary interventions?
Like support group for the patients, teaching, diabetic.
Yep. So they already have something, whether they're diabetic, whether they have cancer, maybe whether they support groups for patients with diagnoses. That could be a
use a
cancer.
glucometer if they have diabetes.
Making sure they can care for them. They know how to adequately care for themselves for diabetes. Do they need supplies? Do they need a new glucometer? Okay. So faith community does much of the same that we would all do as an RN in the community. There's just a heavy emphasis on holistic and spirituality as part of their care. Okay. Okay, next is ethics. Okay, tell me about ethics. Why is ethics one of the basic foundations of our profession? What is ethics? You face all of us face ethical decisions in our life every day. Do we not?
Do the right thing.
Yeah.
Kind of like the same thing as moral.
Yeah. We try and make ethical decisions every day, whether it's personal with our family, our job, our patient care. We make ethical decisions all the time. What is morally right? How do we always try and do good? How do we always try and do no harm? And that's ethically what we want to do. Right? One of the first steps in ethical decision making is you obviously think of ADPI, think of assessment. You have to identify whatever ethical issue that you're facing. Right? You have to obtain the relevant facts, consider approaches. What kind of an ethical principle is it? Is it utilitarianism, which you need to read about in your notes this week, your week 5 notes? There's different theories of ethics. Utilitarianism is one. Okay. Utilitarianism is also called principlism. Okay. You make the decision, you implement the action, and then you evaluate the outcome. Okay, so you need to know the difference between utilitarianism, beneficence. What's beneficence? These are the principles. We always try and do good. There's several ethics questions on the next exam. Okay, our ethical theories, all right, principalism, well, utilitarianism. There's another one called deontology. These are all in your readings. Deontology is evaluating the righteousness of your actions. Right? Utilitarianism is focused on the outcome. And then there's also an ethical theory that's feminist ethics in your readings. Okay, what's feminist ethics? Then there's a couple of ethical principles. You need to know beneficence. Do not always try and do good. You try and do the most good in the circumstances you're in. So for example, let's say you are cathing somebody and your sterile field gets contaminated. What do? What's the right thing to do? What would
Go
people
get a new catheter set.
Right?
Get a new one.
Well, that doesn't always happen. And so my point is, these are ethical principles. If you know you've made a mistake, do you report it?
Sure.
What would any reasonable person do in the same situation? Okay, so your beneficence is do no good. What's non-malfeasance? Do no harm. Do no harm whenever possible. It's the morally thinking through what's right. So when you look at errors and you look at poor judgment, what would other reasonable nurses do in the same scenario? Okay. And then there's another principle called, so there's theories and there's principles. Okay. They're both in your readings. Another principle is distributive justice, exactly what it says it is, right? Ensuring that everybody has access to the same services, same access, same services, same doctors, same treatment, same medication. That's an ethical principle. Does it happen? Are there times when it doesn't happen? Of course, but that's an ethical principle. And then the last principle is autonomy, just what it says. If a patient is in their right mind and can make decisions for themselves, why shouldn't they be able to? That's autonomy. Make sense? So ethics is really, really, really important. Our ethical duty as a nurse is to provide high quality, unbiased nursing care to every single patient we're assigned. Okay, if you cannot, let's say for some reason, culturally, belief-wise, value-wise, you're not able to care for a patient. What do? Do you abandon the patient? What do?
Well, don't abandon the patient. That's not good.
Right. But what do
you
do?
Want to keep your license? Well, I mean, I'm trying to kind of picture a scenario, but maybe, see if there are other nurses that could possibly take care of said patient, especially if, say, for example, the patient is maybe their religion dictates that a certain type of, like, I know certain religions, it's, they only want males taking care of males, or this or that. So maybe see if there are other nurses available to take said patient.
Exactly. That's exactly the right answer. Okay. Part of what we're going to talk about next week is culture and cultural competence. Okay. However, with ethics, if you have checked your values, beliefs, concerns, whatever, and you just are not able to take care of that patient for whatever reason, you must find somebody else that can take care of that patient. I'll give you a really good example. I think it was my second term at Fortis a couple of years ago. I had a nurse who had a friend who was in the prisons. Okay. One of the inmates was in for murder because they killed her sister. And she was the nurse. And she could not bring it to herself to care for the inmate who had killed her sister. Think about that scenario. That has always stuck with me. What would you do? What would you do? And there's no right answer, just ponder it. But the purpose of the ethics discussion is that we are involved, we make ethical decisions every day, all day. Right? What's best for our kids in school? What's best for our kids in sports? What's best for our elderly parents who need care? And a gazillion other ethical decisions. It's not just nursing and work related. We're always trying to do good, right? We're always trying to do no harm. Ethics is one of the critical foundations in our practice. Okay, comments on that? Okay, that's kind of the summary of content. So I want to, just two things. I want to go through the HESI prep assignment, update what we've covered, and then we're going to do quiz 3. So in the HESI prep assignment, you can jump to page 4 under the section of home health. You can fill out that section. Covered that today. Right? And again, we're continuing to do, vulnerable populations. You can, the alcohol, tobacco, and other drug problems is your last box on the whole assignment. If you want to put some more information in there. Talked about mental illness. We talked about LGBTQ, teen pregnancy. So those last 5 boxes on the last page can be completed for today. And then your home health section can be completed. And we're down to bioterrorism, disaster we haven't covered yet. Epidemiology we're going to cover next week. So that whole section will be completed next week. So after next week, let's see, next week is no, the only thing you're going to have after next week is bioterrorism, disaster, cover infectious, and that's it. So we're getting close. If you guys are filling this out as you go, you're probably 75% done, right? Okay, let's jump to quiz number 3. This is kind of a tough quiz. I mean, it's a lot of clinical scenarios. I'm afraid to do anything with my Zoom, so I'm going to keep you guys on here, but I'm going to go to my my quiz. So we're in week 5. So what do you guys have due this week? Just a quiz, okay. And then next week, what's next week? Oh, next week you guys have an NCLEX. Okay. So let's pull up quiz 3. You guys let me know when you're ready. I thought this was a tough quiz, so let's think through this. All right, who wants to read number 1? Now, I have heard of lots of classes doing their quizzes at the beginning. And don't take this the wrong way, but I have a feeling that if we had done this quiz at the beginning of class, I think some of you would have struggled, because based on the amount of participation today by just a few that probably prepared, but I would say that a lot of you may not have, or I don't know if that's why you're not participating, but I would gather that if we did this quiz at the beginning of the class, it would have been hard on some of you. So let's take all the knowledge we learned today and go do our quiz. Okay. All right. Who wants to read number 1?
I got you.
Go.
All right. The school nurse is engaging in a primary prevention program. Which intervention is appropriate? Providing a list of clinics that provide confidential pregnancy testing. Discuss where and how to obtain ongoing contraception. Educate on the side effects of antibiotics for gonorrhea, or create a pamphlet describing an appropriate prenatal diet.
Okay. So what's primary?
B.
The oh,
B, the one where you would discuss how to get contraception.
Excellent. Excellent. Why is A wrong?
Because they already suspect pregnancy.
So what would that be? Secondary or tertiary?
Secondary.
Right. Why is C wrong?
Because they already have a disease.
Okay. Perfect. So what would that one be? Tertiary?
Yes, for sure.
Okay. And why is D wrong?
That would
because
be
they
tertiary
already
too, right?
pregnant, you're gonna do a diet plan.
Perfect. So what would that be? Secondary or tertiary?
Tertiary.
It will be tertiary. Yeah.
Good. Good, you guys. That's great. Awesome. So B's the right answer, right? We all in agreement with that?
Mhm. All right.
Awesome. Great job. Okay, who wants to take on number 2?
I can keep reading the questions if you're all right with that.
Yeah, or if anybody else wants to jump in, just jump in. Go ahead.
All right. Which counseling is appropriate to provide to a pregnant adolescent? Continue using condoms with every sexual contact to prevent STDs during pregnancy. Maintain the usual diet without modifications. Prenatal care can be established in the 2nd trimester, or adoption decisions must be made as early as possible. So they're already pregnant. We've established that.
What do you guys think?
I think continue using condoms for STD.
Yeah, I did A.
Anybody have a different answer? Why is
I think
B
it's
wrong?
A.
Oh, sorry. Go ahead.
I think it's A.
Okay. Why is B wrong?
Because they do need to modify their diet. They need to get prenatal vitamins and stuff like that, and iron.
Yep. Okay. Why is C wrong?
It should be done in the 1st trimester.
Primary.
Well, and you've got a pregnant adolescent. So why would you be counseling her to start prenatal care in the 2nd trimester? Right?
That's need to be done in the first trimester, right?
Exactly, as early as possible, actually.
Yeah.
And then why is D wrong?
Because adoption can be made at any time.
Exactly.
Yeah, and that's a bit insensitive if you ask me.
Right.
This is not your business.
Right. I mean, if they, well, let's not read too much into the question. If they bring it up, I guess it's not something you would bring up without them bringing it up. Is that what you're saying?
Yeah.
Yeah. Okay, number 3.
Which intervention should be prioritized for a child who has witnessed a violent crime? Teach
Okay, so
stress.
hang on.
Go ahead.
Oh, no, go ahead. Go ahead.
All right. Teach stress reduction techniques to child and parents. Assess for family history of post-traumatic stress disorder. Obtain referral for mental health counseling and services, or observe for emotional or behavioral developmental issue.
What is important in that question?
Priority.
Priority. Okay, so we're looking for most important intervention.
I think D.
D. Okay, why D?
It's already you're assessing for their mood changes, how they dealt with it, knowing that they've been through it already, and their acute and possible chronic effect.
Okay, what threw me off with D was developmental.
I think it's C.
Let me finish with D. What threw me off was the word developmental, because I would think that if you're going to observe something developmentally, that's going to be down the road. That's why I thought D wasn't the right answer. Does anybody else have another suggestion?
Well,
it's not C. I think it's C.
Okay. Why is A wrong?
Because this is gonna be primary, because if they already
It's gonna be tertiary.
Witness, yeah.
It's gonna be tertiary, right? The event has already happened.
Yeah, it's already happened. They already,
It's already
witnessed of the
happened.
violence.
Right. And so A is a primary intervention.
Yeah.
Right? This has already happened. Why is B wrong?
Because that's not necessarily a priority.
Priority.
Time.
Yeah.
Exactly.
It's not a priority.
There's time to assess for that, right?
You could do that, just not right now.
Exactly.
The kid saw something that's not fun. Need to find something that'll help him, cope with it.
Yep. So that's why C is the correct answer. Obtain a referral for mental health counseling and services. And once you do that, you can assess, you can do B and you can do D. Right? Does that make sense?
Yes.
Anybody want to add to that? So who said D initially?
I did.
Okay. Does that make sense now?
Yeah, absolutely. I see the setup before you actually jump.
Okay. Awesome. All right, great. Okay, let's go to number 4.
Which nursing intervention reflects secondary prevention for mental health? Screening for depression and anxiety at each encounter, teaching stress reduction techniques to young children, observing for side effects from antidepressant medication, or arranging a support group for veterans with PTSD.
Okay. What are you guys thinking?
What was the first one? Screening.
Secondary screening.
Yeah, that's pretty obvious. Screening. Why is D? What is B?
B is
Primary, right?
Why is it primary?
Because you're teaching.
What are you teaching? Nope.
Before
Teaching
it
can
happens.
happen at any level. Teaching happens at every level. What are you teaching that's preventative here?
It's stress reduction. The amount of stress isn't at a level to where they have a mental illness yet.
Correct. We're teaching to prevent, right? We're teaching stress reduction techniques to hopefully give them adequate resources to deal with stress. So that's preventative. What's C?
That's a tertiary because it's already. They
Yeah,
already
it's
have
tertiary.
Because
already taken medications for the illness or disease.
yeah, they already have a diagnosis. They must have a diagnosis for depression, right? And what's D?
Is that also tertiary? Because they have PTSD already.
Yep. Everybody's
Yeah.
quiet on this question. Do you guys understand the difference? That was a good question that gave you a primary, a secondary, and a couple of tertiaries. Does everybody understand that? Okay, because you're going to have 3, 4, 5 questions on every exam that are primary, secondary, and tertiary. So we have to have a knowledge of that. So if you don't understand, speak up or please get with me. But that's a really good example of a question that has all 3 in there. Okay, number 5, go.
Which nursing assessment is most important in clients abusing oxycodone? Drowsiness, confusion, apnea, itching. Now, me personally, I think it's C. That's going to kill them first.
Mm-hmm.
What else do you guys think?
Yeah, it's apnea.
I say confusion.
Okay. Anybody else have any thoughts? Okay, what is the word in the question that should jump right out at you?
Most important.
Most important. So what would that be? What would be the answer?
Apnea.
Yeah.
Apnea, right?
And it's oxycodone too. It's a high drug.
Respiratory depression.
Exactly.
Respiratory, yes.
Respiratory depression.
Yep.
If anything else comes with it, drowsiness, confusion, itching, we can deal with that. Right? But apnea, respiratory depression is gonna
ABC.
Yeah, that's a safety question. That's a priority and safety question, right? Okay, number 6. Whoops. Need to do that. Number 6.
Which reflects tertiary prevention in substance abuse? Screening for patients that indicate dysfunction in daily life, providing children with information regarding substance abuse, arranging addict-led support groups to promote recovery, or helping parents role model adaptive coping mechanisms.
Okay.
I'd
What do
go
we
with
have to
C,
have for tertiary to be in play?
the condition. So
I'm thinking C.
I think it's C. Support
yeah, me
group
too.
to promote recovery.
Support group.
Mm-hmm.
Recovery.
Does anybody have a different answer than C? Why is A wrong?
That's
because it's secondary.
Because
It's draining.
It's a screening. It's secondary prevention.
okay. Why is B wrong?
Primary prevention.
Yeah, it's
Does everybody understand why B is primary? Trying to prevent substance abuse before it happens by educating them and providing them with information. What's D?
D is also
This,
primary, right?
no,
Would that be primary also?
it's not secondary, D.
What do you think B is? Or D?
No, it's primary.
I say it's
It-
secondary. I
Yeah,
say
I
it's
think it's secondary.
I say it's secondary because it doesn't say, it's not trying to prevent something. It's trying to head something off before it gets worse. Does that make sense? Early intervention, early screening.
Mhm.
So I
Yeah.
consider, does everybody understand that? That's a hard one. I went back between primary and secondary, and when I really thought about it, I really think it's secondary because, you know, you think of secondary screening, but I always try and expand that. If screening doesn't jump out to me, I always then say, okay, well, secondary is also early intervention, early treatment. Okay? Does that make sense? Okay. All right, question 7.
Which nursing intervention reflects non-maleficence? Obtaining a new urinary catheter kit after contaminating the sterile field, inserting a feeding tube to administer meds in a client who swallows normally, failing to document observed side effects to administered medications, maintaining confidentiality of a fellow nurse who is working under the influence.
Okay, but what's non-malfeasance?
A.
Doing no harm.
It's A.
No
It's
harm.
what?
A.
A.
Why do we think it's A?
It's the only thing that's a good thing.
Because she's doing a good thing. She's
Okay.
doing something
harm.
not causing harm.
Okay. Why is B wrong?
He swallows normally. He doesn't need that.
For so many reasons.
Yep.
Why is C wrong? What is C?
Failing to document observed side effects to administered medications. If they're having side effects, it's important to note those in case they become a problem.
Right? But does that fall under beneficence?
Yeah,
Do no
I
harm?
think so. Yeah, I think so.
Okay.
Because if they have a side effect that's particularly, safety threatening, then yeah,
Do no harm.
exactly.
What about why is D wrong?
She should okay. I don't care how good friends you are with your coworker, him or her does not need to be coming into work after they've had something to drink. Okay, that puts them and the patient at risk.
Is that an issue of beneficence?
Mhm.
Do no harm.
Absolutely.
Okay, so you got to understand the difference between malfeasance and beneficence, and that question perfectly sums it up. Everybody understand that? Those are a few of your ethical principles. Okay, we're getting close. Number 8, go.
A hospice nurse notes the client's pain is poorly controlled despite a fentanyl patch as needed. Sublingual morphine. Which intervention is appropriate? I'm sorry, it threw me off for a second. Wait, that was space. All right. Add a non-pharmacologic pain management to avoid the risk of addiction. Notify the healthcare provider of the need for additional pain management. Counsel the client and family that a pain-free death should not be expected. Remove the fentanyl patch early and apply a fresh one in the same location. So
what are the important words up in the question? What kind of nurse are we working with here?
Working with a hospice and they're in pain.
Hospice nurse, so we know we're taking care of an end-of-life patient.
And I I I think it's B as well, because
It's B. I'm going with B.
Yeah,
Yep.
it's B.
B is the right answer, right? With A, are we worried about addiction at this point?
No,
No.
absolutely not.
Right? Well, do we ever counsel a client that a pain-free death should not be expected?
No.
no,
Should be just the opposite,
Mhm.
right? Because what is one of our primary responsibilities is comfort.
Comfort.
And then why is D wrong?
I mean, if
When
it's
you
if
remove it, you
it's
don't put it back in the same spot anyway.
Right. Right. So everybody understand why B is correct.
Mhm.
Okay. All right. Number 9.
All right. The client tells the hospice nurse, "I do not understand why God is punishing me." Which response is appropriate? Let me pray with you for forgiveness. Do you have a pastor I can call for you? Dying is just a normal part of life, not punishment. Or what makes you think you are being punished? We'll go with, I think it's
What do you
D.
think?
It's an open-ended question, and it helps facilitate the patient telling you their feelings.
Okay.
I think it's
Anybody
B.
else have a different thought?
I think it would be D before B, as he
I
said.
think it's D.
I think it's B too,
Why do you think it's B?
because you should ask them for a pastor, because you can't really like tell them like it's not their that it's not their time. It's like you kind of like trying to like pacify them more so than you're trying to actually get them help to understand what's going on.
That's excellent. That's an excellent answer. And I'm not sure that as a hospice nurse, you want to take on the answer of C. Right? Why is A wrong?
That's not your place. That's the place of the chaplain.
Why is C wrong?
That's a bit apathetic. Like, it's a little callous on that one.
And what about D?
Yeah, no compassion.
Yeah, exactly. So one of the roles of the hospice nurse as well is to use the resources she has available to him or her. And that would be a perfect opportunity to involve a pastor or a priest or a rabbi or somebody to have that discussion. Does that make sense? It doesn't need to be you.
So it's B then.
Yeah, the right answer is
Okay.
B. Yeah. And then number 10,
All right.
last one.
A client with metastatic cancer has made the decision to stop all cancer therapies. Which statement by the nurse reflects a respect for the client's autonomy?
What is
Would you
autonomy?
like-
We talked about this. What's autonomy? Letting the client make their own decision.
Yeah.
Okay,
First
go ahead.
option being, would you like my help in sharing this decision with your family? Let me see if the physician can talk to you about the benefits of radiation. Do you think this is the best decision to make with regards to your family? I've heard the new chemotherapy treatments are not as awful. The only one that
There's only one
is
here that makes sense.
the only one that's your place. Be the first
Exactly. And which one is that?
one. A.
Does everybody agree? Can everybody see why
I'm
A
sorry,
is
I was out of the Zoom. I don't know what was happening. What do
No
we
worries.
pick for 9? It's merely.
Yeah, no worries. No worries. A is the only correct answer, right? Do you understand why, guys? This is all about autonomy. Clients making their own decisions. Why is B wrong?
Because they've already said, I don't want it.
Exactly.
The doctor coming in to tell them, oh, this and this is probably just going to annoy them.
Correct. They've already made the decision. Why C wrong? It's not up
That's
to
it.
you. It's
Yeah,
not,
and that's throwing a little like of your own feelings into it.
yeah. It's not up to you to assess whether this is the best decision. It has nothing to do with you. And then why is D completely inappropriate?
I don't think he wants to hear about that.
They already decided they don't want any more treatment. Right? So again, lots of clinical scenarios here in these 10 questions. And that's what I'm trying to get you guys to do is take this knowledge that you're learning and apply it to clinical situations and using your best clinical judgment. Okay. Questions? Has this been helpful? I know we covered a lot today, but it's been helpful. If you haven't done your legwork, you need to go back and review your readings. Make sure you hit submit for the quiz. Make sure you put your name and your campus in the chat.
I have a question.
Yeah, 1 second. Make sure you sign up for a review session with me if you want. I had, let's see, I had a student who had in the 90s today want to get with me and see what 3 questions she missed. So everybody is welcome to review the exam when we'll identify the concepts missed. Okay. Okay, who has a question?
Me.
Who's me?
Yashika.
Hey, Yashika.
Hey, so this is regarding the quiz on number 7 when we was talking about the non-male species with the do no harm. We said it was D, right? Because it was like maintaining the confidentiality of the patient that was on. Okay. Okay.
What was the correct answer, you guys, to that question? Was it number 7?
Yes.
Okay. Did you get that?
Yeah, I got it.
Okay. Okay. No, we covered a lot today. Good discussions. Some of these are hard topics, especially week 4's topics of the specific vulnerable populations. But again, like I said, from week 1, you're in the community, you're in public health nursing, community nursing. This is what you're going to be, this is the populations you're going to be working with. Okay. Anybody else have any questions? I'd be just get your group project done. It's week 5. This is a week that you have an NCLEX assignment due. So, I mean, try and get a jump on your group project, at least get the portions assigned that each of you are going to do. Give yourself a week to do it, and then somebody pull it all together and get it submitted. Again, we're in week 5 right now. Once we get to week 7, it starts getting busy. I already told you guys about this. 7, 8, 9, 10, busy week. So just carve out a little bit of time each week for community. That's it. I know you got exams coming up and papers due. So I'm here to help support you guys with whatever you need. Okay? I hope you guys have a fantastic week. You know where to find me. I'm meeting with lots of students in the next couple of days, so looking forward to that. Love my student meetings, my one-on-ones with students. Really like those. So if you need to reach out to me, please do. Okay?
All right. You have a good one.
All right. Bye, you guys.
Thank you.
You're welcome.
Thank you.
I still cannot set my quiz. I don't know. My internet is giving me some kind of problem. I don't want to be in trouble. I still can't send it. I might send it after because I do it. My internet is saying it's dropped. I don't know.
Did you get all the answers?
I think I got it, all the answers, but I keep getting out of the